The mother of the Texas man who attacked Dallas police headquarters this weekend tells CNN her son had a history of mental illness. No surprise, but that he had simply reached the breaking point, and so had the whole family, to be honest. So this morning, Congress is going to hold a hearing on a new measure designed to overhaul the existing mental health system with the hope of care to some of the 11 million Americans suffering from severe mental illness. Joining us this morning, Virginia State Senator Creigh. You'll remember him from the story about his son suffering from mental illness who took his own life a year and a half ago after attacking him. And we have Pennsylvania Congressman Tim Murphy, sponsor of the new bill, friend of the show. Gentlemen, thank you for joining us. Once again, Representative Deed, we are sorry for your loss, but thank you for making this part of your passion for change. And Congressman Murphy, as we have from the beginning, we've been following your hunt for change. How do you believe it sizes up going into the hearing?
Well, we've made a lot of significant improvements on the bill. We think it's more focused, listened to a lot of Republican, Democrats, a lot of families, a lot of folks around America. We're going to go at this hearing. I'm thankful Senator Deeds is going to be here. He and other people will have a story to tell. And that's what we want America to understand and Congress to understand, that we're here to really fundamentally change this system so we can have treatment before tragedies.
All right. What do you want this bill to do, Senator, for those people who are going to be watching today, hopefully with fresh eyes?
We've got to reorganize our approach to mental health. We've got to create a national conversation, begin a national conversation. And what I'm particularly attracted to in this bill is it makes important changes to the HIPAA law that allows adult children to be cared for by the parents or family members that already care for them. It gives them access to information that will allow them to provide better for their children.
The typical problem, Congressman, is that the family knows there's a problem. They can't make somebody get treatment. They can't do anything to keep them safe. What powers would you give them now?
Well, this would be for that family who's known caregivers. A doctor could provide them information such as when's the next appointment, what's the diagnosis, what's the treatment plan. Because when you have someone with severe mental illness, sometimes they lack the understanding that they have a problem, and they lack the ability to follow up on their own care. Many times they have other medical problems like diabetes or lung disease or infections. And we know the loving family member ought to have that ability to help guide them through there. They never stop loving their child because they have an illness. We think that's an important part, and quite frankly, I think America believes that's an important part too.
And yet, there's been resistance, Senator. You hear people saying, well, you can't change the HIPAA laws. You're going to take away someone's privacy. You're going to create this imbalance of people's personal rights, and you're going to wind up having people forced into treatment, and this is about choice and freedom. What do you say to that criticism?
I say, your choice is not to die. Your choice is not to watch your children die, watch your family members die. Here's the thing. In the 19th century, we were institution-based system in our approach to mental health. Now we've gone completely the other direction. We've gone from a position where we took people's civil rights away to one where we've given them the right to die. And I don't think that's what most people expect, and that's certainly not what most family members expect this system to provide for their loved ones.
And if I can add to that, Chris, it's also, I hear judges sometimes say, well, it's not against the law to be crazy. Well, it's not against the law to have a heart attack, but we do something about it. It's not against the law to have Alzheimer's disease. But we step up and help someone who cannot make decisions for themselves. Compassion demands this. Reason demands we make some changes in these, not just the HIPAA laws, but providing for them more hospital beds, more providers, sounder research in these areas, making sure federal dollars are spent well and wisely on this. And quite frankly, we haven't been doing a very good job. And that's not me saying that. That's not just Senator Deeds saying that. That's the General Accounting Office saying the federal government hasn't done a good job, and we have to change this for the sake of families' lives.
Who's saying no? I mean, you've been fighting this fight for a long time, Tim, and it seems like they're not saying it to your face so much as killing it somewhere behind the scenes so that you can't get this made into law. What is the resistance?
Well, some organizations don't want any psychiatric hospitalizations. They think you should never tell someone that they have to be in treatment. They don't, in some cases, quite frankly, they're against psychiatry, against medication. Look, this is not the same field that it was 20 or 30 or 50 years ago. Things have advanced dramatically. There's a lot we can do to help people who are in a mental health crisis, and we ought to be doing that. So those who are adhering to old worries, I said we've got to move forward, and Congress needs to do this too. So it's a matter of having the political will and also coming together politically, because quite frankly in this, Nobody with mental illness, it doesn't matter what party you're in. It doesn't matter what income or race you are. It's a matter of how we can work to get this done.
Congressman, you've been living this situation clinically. You've been living it in your family. You've been living it as a professional senator. You as well. To those who would say you can't force people to get treatment, it's not fair to them, what would you say from your own experience?
You don't want to watch someone you care about die. You don't want to watch them kill themselves. And that's essentially what you are doing. People have to... So many people have reached out to me the last 18 or 19 months, and family members whose children are hospitalized and they have no information when they're released from the hospital. They have no way to know how they're supposed to react, what they're supposed to do to make sure they get their treatment. People don't have a right to kill themselves in front of you, and that's essentially what the system now allows. We've got to make a change.
Too many families are helpless. They're looking for something to change. Hopefully this will be part of the solution. We will stay on this story as we pledged from the beginning. Gentlemen, thank you for coming on to New Day. Good luck today. We look forward to see what happens.
Thank you, Chris.
All right. So what do you think? We keep seeing these stories. Is this the type of answer that we need or no? And if not, why? Tweet us. Use the hashtag NewDayCNN or post your